Okay, today I'm going to demonstrate and show how to do a barium contrast study. And we're going to do a demonstration of this on a little stuffed animal. Before I get everything ready, I just kind of want to briefly touch on the indications of a barium study. Sometimes this may be a diagnostic test that's ordered just for a patient that has some reoccurring vomiting, some diarrhea, anorexia, maybe some blood in the stool, continued weight loss, possible foreign body that could be going on. Maybe we took an X-ray and it looked like there was some organ displacement. So it'll just kind of give us an idea more of like the position of the organs, maybe like the size and the shape of the organs, maybe if there's something that's obstructing the flow of the food and stuff from the stomach or in the GI tract. We don't want to perform a barium study if there is some distension of the abdomen or the esophagus, if there's like some fluid distension going on, or if the patient is having more like attacks with the bowel movements, and there really isn't that muscle tone present there. So before we start, I just kind of want to touch on some of the things we want to have ready. We obviously want to have all of our X-ray materials ready. So like our calipers, for example, our gown, all the protective equipment, which we'll touch on later. But for the actual study, we do want to have our barium, which ours is pink, just because we don't do a lot of barium studies in the hospital. So I'm going to use Pepto-Bismol just to have that same effect on the X-ray. Usually it's white. We have our tubing that we'll use for the orogastric intubation. I do have some lubricant that we'll use before placing that. And then our Arola tape that we'll use as more mouth gag. And also our towel, just in case it gets messy. And then I have our patient here that's de-stuffed that we'll demonstrate on. So this patient is a duck, but if it was a dog, it would be kind of like Chihuahua size. So I estimated us to be about 4 kilograms. So I have pre-measured the barium, and I used 10 milligrams per kilogram, and I have 40 drawn up in our syringe that we'll use to administer. And then before we start as well, I'm going to use calipers here just to measure and write down our settings, so then that way I can have the radiograph machine all set up and ready, because once we administer the barium, we do want to take an image pretty quickly. We want to take that image when the stomach is fully expanded with the barium before it starts to move on to the rest of the GI tract. So that way everything's all set up and we're not wasting time in between. And so for our VD, I did get about 9 centimeters here. And then for our lateral, we are a box. We would also be 9. So I'll go ahead and I'll use our technique chart just to get all that stuff set up real quick. So I have a little dog duck set up here for a lateral view, a right lateral view, before we administer the contrast agent, the barium, just for scout radiograph, just so we could have something to compare to. We're a little floppy, so I did put this positioning wedge underneath here, so we're not flopping over. And then I dimmed the light so that way we'll be able to see our collimation here, which is going to be which will entail the abdomen here. And then I have our marker that I'll set down here on the side so it's not obstructing anything there. And then I'm going to get out of the way here since our patient isn't going to be going anywhere, and I'll take that radiograph real quick. So now that I have everything prepared, I'm going to have Sarah help us chain Ducky here so I could do the oral gastric intubation and then administer the barium. So what I'll do is I'll first pre-measure this tube. So on the side here, I'm going to be measuring from the mouth all the way down to the last rib. And what I did is I put a little piece of tape there, so that way when I'm placing it, I'll be able to know exactly when to stop placing it and we don't go too far. Then I put some lubricant on the outside of the tube, so same thing, it's not going to irritate the esophagus. And then what I'll do is I'll use this roll of tape here as a mouth gag and have Sarah hold the muzzle here. Then what I'll do is I'll grab our tube, I'll place that and have pretty much the patient swallowing the tube up until that point where I measure. And then what I would do is with the assistant holding there, I would have my syringe and I'd start administering that. Just because I don't want this medication to get, this is why I have my towel. Okay, I'm just going to have the towel here just so it doesn't squirt out. So I'm going to keep administering it until we give all of it, and then I'm going to let gravity work its way down so then that way it doesn't get all on the inside of the animal. And then I'll just take an x-ray here in just a moment just to show exactly how it looks when all that gets into the stomach. I'm just going to put a little stomach in our stuffed animal so that way we could see that. So now that we administer our barium, I prepped our patient again so that way we could take right lateral, left lateral, and a VETT radiograph. So same thing, we're going to be making sure our plaques are back and on top of each other. Then I have our left marker here. Our stomach's going to be right kind of where the ribs end, which would be right around here. So that's going to be our little barium pouch is placed right in there. And then I have it well collimated. So I'm going to do take the left lateral radiograph, and then we'll flip the patient on the back to take the VD. Those will be the images that I'll submit, but if we are continuing the barium study, then we do want to continue taking a lateral image as it continues through the system. And so for our dog here, 15 minutes after we would take our immediate x-rays where the barium's in the stomach, then we would want to take another image, and then at that point it would be starting to get into the small intestines, and then continue through the small intestines up until about an hour, where it should be completely through the full sections of the small intestines, and then about 2 hours later is where like the cecum's typically reached, and then 4 hours later is when like the barium's completely through the GI tract. So I'm going to go ahead and snap this x-ray here, and then we'll do the VT, and then I'll discuss some of the main points about the barium studies. So to note a couple additional points on doing a barium study, for one, after we get everything ready and we place the orogastric tube, if we're not using an endotracheal tube at the same time, it's very important to make sure that the tube is in the right place, so that way we're not administering barium into the trachea on accident, because that would be a disaster. So what we do is, once we have that tube placed, we could actually palpate the esophagus. And what we should be feeling is two different tubes. One being the typical trachea, since that's got that hard cartilage surrounding it. And then we should be feeling the tube that's in the esophagus. Typically, you can't really feel that esophagus, but when there's a rigid tube in there, then it'll be easily palpable. You could always possibly feel it lower down, but that's a little bit more difficult. The other option is also possibly blowing into the tube, and then using the stethoscope to listen near the stomach for bubbles as well. Then we'll continue administering our barium study. For our patient, for just the demonstration purposes, we didn't take the full amount of radiographs that we would, but typically what we would do our survey radiograph that would include our right lateral, left lateral, and VD, and that's just really there to make sure that we're doing the appropriate exposure, and as I mentioned before, it's going to be used for comparison purposes. Then we want to keep repeating a right lateral and a VD radiograph at the 15-minute mark, the 30-minute mark, the hour mark, and then we'll continue repeating that every hour until the study is complete. Couple of things. So the reason, what we'll be looking for is when that barium's administered, barium tends to have a high atomic number, and so what occurs is it shows up, it'll tend to absorb more x-rays, and it's going to show up white on the radiograph. In my demonstration, I used Pepto-Bismol for that same reason. It's going to perform that same function. The concern is with Pepto-Bismol, with barium, is that it is not, it's insoluble, so it's going to be under the doctor's discretion if we want to perform a barium study, because it could be really risky if there is some sort of perforation in the GI tract, as then it could leak out somewhere, and then the body's not going to absorb it, and we could have barium where it doesn't belong. So definitely the veterinarian will weigh the option as to whether it's appropriate to perform the barium study or not. It is also really important to make sure that the pet's fasted for about approximately 12 hours, just so that way we don't have any food or anything that's really obstructing our view, especially if we are devoting that the time that it takes to perform a barium study. We want to make sure that we're doing it appropriately. And then sometimes if we are doing a barium study, the GI, there might be some abdominal stress going on, and if that's the case, then we would actually avoid fasting the pet, but majority of the time we do want them fasted. Otherwise, we just continue to take all the radiographs that we need, and then once we have all the views, the veterinarian will be able to analyze those and kind of look at some of the things that we mentioned before, screen for either any possible obstruction that's occurring in the GI tract, maybe just checking out the organ location, the morphology of the organs, and just making sure that everything is flowing through the GI tract appropriately. And that's it. Yeah, so those are just some of the main points of doing a barium study.